So good morning, I'm Jason Alexander. I'm the court entry consultant for the Eastern Pennsylvania Continuum of Care. This is our first court entry office hours in the fall of and winter of 2022. And it's a wonderful opportunity to not be meeting on a Monday morning at 8:30 a.m. So thank you to the 211 team for allowing us to interrupt your ongoing meeting schedule and bring together all of our court entry managers, specialists, both 211 and Access Site. The first thing I'm going to do is touch on some highlights, recent highlights since our last office hours, and then open it up for questions and answers. And Patricia, you certainly can take the first question. In the meantime, please use the chat to tell us who you are, to post questions if you have them, and we will answer them by 9 a.m. And any other feedback you want to add that for the good of the group. So the most important highlight Jennifer has already noted, which is that unfortunately, one of our long-term veteran court entry regional managers, Maria Schramm, is leaving us at the end of November. And that's the sad news. The good news is that her role will be taken over by another member of her agency, who I think may be joining us today, but certainly I would imagine next month, and that's Liana Rufer.
Riatort.
Okay. And is in the process of being trained now and will take over responsibility for managing the Pocono region by name list in December. So more information on that coming up. But Maria, thank you for being amazing. And as Jennifer said, we will miss you.
Thanks. I appreciate it.
Some other updates, and we've sent these out recently, but I'm going to share my screen. We issued two important updates, and I'm sure many of you have already dug into this and are comfortable with this, but just to make sure, we've slightly modified the disabling condition question and sent out an email blast with directions on exactly how to ask that question. Ideally, this question would populate in HMIS workflow, but unfortunately, there's a certain part of the HMIS system that's locked down by HUD requirements and can't be modified. But this is the question, and I know it's long, but the disabling condition yes, no toggle during court entry intake really impacts a household's ability to access certain housing services that are restricted to people with one of these disabling conditions. So this question in blue is really essential that it be asked this way, and that you then record the answer, yes, no, client refused, etc., based on the answer to this question.
Can I ask, just out of curiosity, more for our other contracts, is that verbiage HUD's sort of language, or we crafted that? It makes sense. I know why. I know the why behind it. But I'm just curious because we have other contracts that we're not asking it that way, that maybe we should.
Well, yes, that's technically HUD's language from the 2022 HMIS data standards. So that
Okay.
is the question HUD expects to be asked.
Okay, perfect. Thank you. Make a mental note, everyone that does Berks in Lancaster. I'm just kidding. We're Lancaster.
I mean, the most important, I'm sorry, just to clarify, Eileen, if I could, the most important thing is the list of things that are read as possible disabling conditions. That's what needs to be exactly read. It's possible you could tinker with what's around it, although that's really how HUD would like it asked. Sorry, Eileen, did you have a follow-up?
Yeah, I've been using the question, but I wondered, it's just for the head of household only, right? If there's someone else in their family with that, and it's, of course, we ask that question later too for all the family members. How does that work when it gets to the agency? Do they just consider the head of household? Or are they considering if there's one family member that has that disability?
That's a great question. It's primarily focused on the head of household. But different agencies will use as much information as necessary. But the baseline assumption is that this disabling condition is related to the head of household to qualify for certain housing programs. And also in most data reporting, either locally or at the HUD level, national level, the trend tracking is heads of household with a disabling condition, which has an impact on system level funding and planning.
I'm sorry, can I just ask a question regarding that? Is that to be interpreted as like someone with a disability should be made the head of household?
No,
No.
the head of
Right.
house,
Okay.
this is a question for whoever is already
Is
designated.
already the head of household. It's not something that we switch based on that. Just wanted to
No.
confirm that. Thank you.
No. Great questions. So the other major clarification is how to ask the gender question in the workflow. And again, this is guidance that went out recently. It's actually important that you read the entire list and let people opt in yes or no to all 5 of those gender identities. Again, this is also prescribed by HUD in their HMIS 2022 data standards. So this is the appropriate way it's to do it. And they can identify with whichever they'd like, as many as they would like, or they can refuse to answer the question, of course. But the other important reminder in this is what's written in italics at the end of paragraph 1, which is making sure that core entry intake notes not contain information about a person's gender that either varies from the answers that are in there that they gave during intake on their client dashboard, and should not be written in the intake notes without their verbal permission. So we do have occasions where we're finding core entry notes with gender identified in ways that are not aligned with what the client answered during intake. So we want to minimize that. Any questions about gender? That's interesting, Eileen. And then the last thing, because I'm not sure we've had an office hour since the upgrade to Client Track 20. And of course, we've all been using it for a while, but just as a couple key things you may or may not have noticed in it, and a couple of recent additions to it. First of all, we do it. I know it's time consuming, but it's really important to try to get as much contact information as possible, and to make sure that we've checked if we know whether it's safe to contact, particularly for public DV clients, but really anyone. So the more information we get, the more likely our housing service providers can reach someone in need when they have an opening. The other couple things are, you're all aware, I hope, that there's now a dark mode again. So if you click on your settings, and I'm assuming you can see this, but if not, there's default high contrast and dark mode, which is just a recent re-addition to Client Track 20. The help button went from the upper right, as you know, to the lower left. There is new documentation. So if you click view documentation, there's actually a user guide that is published by the vendor. It's a little wonky. I mean, stick with our core entry policies and procedures, but if you want to, you certainly could take a look at that. And also, of course, if you are submitting a help ticket, you would use report an issue. You could use these others, though, ask a question or make a suggestion, and they will be considered by our HMIS team. And then the other thing I wanted to make sure you knew is that we are starting to use this PAHMIS training. I don't know if you're aware of this. It's under your home screen, but if you click this folder open, there are really 2 things you can do. One is click to training videos. They're not all intended for us. So if you select category and pull that open, there are videos just for the Eastern CoC core entry system. And at some point soon, I'll be connecting our YouTube training video series here. So you can use that. Also in the reading materials, same thing. You can filter for Eastern CoC court entry. And for example, I'm starting to document here and save here the recent email blast like disabling condition, how to ask gender. You can access our policies and procedures manual here. And this is actually a one-page PDF of all the resources and links that we keep for court entry specialists as like a reference guide. Any questions about Client Track 20 while we're here? And of course you have favorites, which is new. You can bookmark your own favorites, kind of like web bookmarks. So that's the star menu under the home screen.
I have a question, Jason, and when you have people that have children, they can't remember the social security numbers, I try to get as much of that as I can. How does that impact our quality? Because I remember on another state, it really did. If we didn't have the socials, how important if they don't have them?
It's an element of the annual HUD review of our annual performance. But the ideal is that we have that information. I don't believe that we are going to get in serious trouble when that information is not populated for family members.
I mean, we don't have.
I can't do it. I couldn't do it right now. I can do mine and that's it. So I think we all can relate to that, not having those memorized. And ultimately those can be added by the housing and service provider. So this is not the only point at which that data would be scored, if you will, by HUD in terms of completeness. So my guidance is do as the best you can. But most important is the head of household social security number during court entry intake. So I'm going to open it up. There's one reminder, and I'm going to ask for the CE regional managers to help me and Jennifer to help me with this. Please do not put personally identifying information into DV anonymous records and case notes, including pronouns. Do you want to say anything else about that, Jen?
Yeah, and the 211 folks who do this day in and day out, I very, if ever, see that come through. But certainly for keeping notes sparse for any DV client, but for DV anonymous, anything that could be personally identifying, even though I do recognize that on the tail end, when those referrals come in, it can make it more difficult or more stressful for the person calling to not have an expectation. But we do want to keep out anything but like the bare bones for DV anonymous. So just making sure you're not including little things like that, because unless you're actively thinking about what you're typing and that this is kind of like a different note qualitatively than all the others, it's easy just to throw in like, well, I just spoke to this person. He said he's a guy. So you type in a few keys. But that is part of that PII, that person identifying information we're trying to make sure we keep out. Does anyone else have anything that they want to say on that? I think that might have been an Erica one or something that came up for.
I want to sort of piggyback that, and I don't know that, I don't know, maybe I'm reading too much into it, but as I was on the BNL call for Lehigh Valley yesterday, and we were going through some records, I noticed that an agency in a DV Anon had put in the case note referral to Turning Point. And that right away was kind of a red flag to me. I mean, we can see it in the referral, so maybe it's not as important, but seeing it written out in a case note was not fantastic for me.
Yeah. Do you remember? Well, I'll ask Francisco. Did he happen to say anything? Because I was
No,
that one.
I don't think he noticed it. We were going from top to bottom, so it would have been in the first, few, but yeah, it struck me as that probably shouldn't. I know for our intakes, we'd never list those types of referrals when we put, shelters listed, or any referrals.
Something like that. That's yes, a referral was made, but you do not need to be giving a specific location, especially for those clients. So thank you for mentioning that.
if just double piggyback on there for the DV non-anonymous intakes, I don't think we want to include anything about warm transferring. We don't want to include whether like any of that, correct? As well.
Right.
Yeah.
Eliminate that.
There's no,
Yeah, we don't mention any abuse or safety necessarily. It's just they're in the situation they need to, yeah.
and I
Cat
think
4 is the only notation.
Cat 4 at the
That's it.
top would be the only, no
Yeah.
mention of.
And as a reminder, there are some, for folks who don't do this all the time, looking at the names in here, I know that maybe that doesn't apply, but I'm gonna say it anyway. There are example notes in like the coordinated entry Google Doc, and also like if that is something specific that you have questions about, maybe you want to have like a 15-20 minute conversation about notes in general, then just let me know and we will set that up. But it is good to just have, like I said, bare bones and certainly not specific agency names. Because if somebody does have safety and security concerns, we do not want someone potentially to be able to, they flee a situation and it's like, oh, well, now I know where they are. So that's why we don't want to be including that.
So I have a
Also, don't forget about the DV, sorry, Jason, DV public. Please make sure you're putting the safety information in that note. Even if they want their name to be public, we still need to know whether it's safe to call, safe to email, all that stuff, because they could be sitting right by the abuser and the person who's calling them a provider has no idea. So they need that information just as much as the DV anonymous.
Let me take one quick step back and then let Patricia pose a important question. But I meant to note when we were talking about the gender question, if you need for some reason to identify the gender of the person in a CE intake note, and the person's identity is trans, please do not put transgender male or female. That's outdated. That's no longer part of the HUD data standards. So it's just trans or transgender with no other qualifiers. So let me, it's important you're still here, Jennifer. So let me give the floor to Patricia.
So in the past week, I mean, literally like 7 days, we've had, gosh, maybe close to a half a dozen instances of this specific question. That is, I think it's going to become more prevalent. And I don't know that I'll own it, that I've been given the proper guidance. We have had individuals who are answering the DV safety questions and that, perhaps a no, but then elaborating that they're leaving because of verbal abuse. That has been like 3 or 4 of those in the last week. And then we've had someone who was living with a roommate, and the roommate was just continually like sexually harassing them. But no violence has occurred or anything like that, but just kind of propositioning the individual, if you will. So they were leaving because of that. So I personally didn't think that was Cat 4 because of there like no violence had actually occurred. It's a crappy situation for sure. But I don't know that that's accurate, but this has been a common thread in our 211 Teams chat in the last week, more than I've kind of identified in recent months. So can you talk about that? Like what is your thought on that?
Yeah, I'll give some general guidance. So sort of first and foremost, they're going to be the ones who are assessing whether or not that's a safe environment. So things that are said kind of conversationally, I would say precedence needs to be given to how they answer those specific questions, because those are formatted that way for a reason and they're done systematically. It's fine to like ask a bit of follow-up if somebody says something that leads you to think maybe this is indicating there is some safety concerns there. But to your specific question about whether or not like active physical violence needs to be present or have already occurred, no, because that is sort of the preamble to escalation of violence in a domestic violence situation, or if we're talking about The question that you gave about sexually propositioning, that makes me think of something that we talked about in the last 2-in-1 staff meeting. An example was given of somebody couldn't make rent, and then the roommate was saying, to stay here, you have to like give me sexual favors. That is certainly an unsafe situation for that person, because that is now a threat of sexual violence in that household if somebody is taking it to that level to make that like a prerequisite of staying there. So there doesn't have to be, law enforcement call. There doesn't have to be somebody has already struck another person. It really depends on that person's own assessment of like, is that a safe nighttime residence for them? And then if we do end up getting like a false positive out of that, that is where it comes down to the program level, after they have already sort of self-selected into being DV, for them to determine like, is this person a good fit for our program? And that might include them digging in a bit more, and does include them digging in a bit more about, is this person like actively fleeing some form of violence? And so those are the situations where the case manager will let myself or regional manager know, hey, this is definitely a no. And then they get sort of, their categorization gets reassessed, or hey, this one's kind of a murky gray area. And then I'm the one reaching out personally to talk to that client and to try to figure out, in a way that doesn't seem like it's investigating, but is also trying to get at, does this actually kind of qualify for HUD standards for category 4? So that is sort of like my overall response to that. Does that help, or does that make things more confusing?
I'll
'Cause
leave that to the team, because I
I want to keep that, because that's kind of been the through line, right, that we've discussed of when people call in, it is up to them to self-certify. It is not
Right.
up to Access Sites or 211 to have to be in that position, to try to double up as advocates and as investigators, and dig in, because that's not fair to you. And also the other side of that is, we do not want a survivor calling in and feeling like, potentially the first time ever that they've disclosed something like this, they are now getting like the reality of it is getting questioned, because that's gonna probably shut someone down and make them less inclined to reach out. And I do know that we're getting more DV calls, and I also am a realist, and I recognize that not all of those are to the standards of what HUD is saying fleeing actually counts as. But that's why there's sort of this whole second portion of everything that goes on, where we can still sort of interject ourselves into the situation if this person doesn't truly qualify. And that could happen with category 1, right? Like, you could have somebody call in and say they're literally homeless, a program gets a referral, they speak to that person, and they determine, no, actually this person stayed at their cousin's house for the last week, and so we're going to reassess how we have them entered. I know that just because of the sheer volume of DV folks, it comes up maybe more, but I don't really have as much of an eye to the Cat 1 side, so I can't say that for sure. But sometimes it happens, and it comes out of people's desperation to try to get housed, try to get assistance. But we do have like measures in place where we can still kind of catch that, for lack of a better term.
So I think the tough part for us is, so it's oftentimes not an intimate partner that is, they're like verbal abuse, arguing, whatever. So they say no to question 1 because it's not an intimate partner. It's their grandmother, it's their mom, their dad, brother, sibling, whatever. But then when we go to question 3, which is, or whatever the next, series, where if, attempting to flee other dangerous or life-threatening conditions related to violence, that's where is a verbal abuse. Is that meant to, then they have that option to say yes? Again, I know that they're self-selecting, but when they're saying like, I don't know how to answer that, we're repeating the question.
Yeah.
Is that form of violent abuse?
Yeah, I mean, it definitely can be. So if it's
Okay.
you're having a squabble with a roommate over bills, and no threats come out of that, but if you think about somebody who's and familial abuse still falls under the umbrella of domestic abuse, right? Because it's not just for romantic partners, dating partners,
Sure.
folks who are married or having sexual relations. If you think about somebody who, in their sort of cycle of abuse, that person is making threats of, I'm gonna hurt you, I'm gonna kill you, I'm gonna hurt the kids, like that could kind of quote unquote only rise to level of verbal, but that is very much like a part of the cycle of when domestic violence is the stage we want to catch it at before something more serious happens. Because that is definitely a normative part of like escalation that happens where things maybe start out with verbal threats and things along those lines. And then other types of like control get brought in. And then a bit further down the line, that's when it turns to physical violence a lot of times. And so that is ideally the stage that we would be catching it at, is before anyone ever actually, ends up having to be in an emergency room or getting struck or getting put out on the street or something like that.
Okay.
And I'm sorry, I realized that it's 2 minutes till.
Yeah. Well, I knew it was going to take a long time. So, I mean, I guess just if we can survey any, whether you're access site or any C specialist in general for 211, is that going to help you? Like, it's that question is brought up and they don't know how to say. So I'm like, I don't think it is. But again, that's my opinion, unfortunately. And so are we clear now that we don't need to ask that question again? It's basically kind of where I'm at. Are we clear on how we would handle that based on, I mean, every situation is going to be different. But is that helpful for CE specialists?
I
Okay.
think Jake maybe just gave me a fist bump or gave you a fist bump. So I take that as a very strong, solid indicator that that's good.
Okay. Thank you.
So as it says in the chat, I know some of you have to leave right at 9 sharp. But we'll continue if there are other questions. Does anyone have any questions they want to either post in the chat or just unmute and ask anything related to court entry? Okay, then maybe we can sign off right at 9 a.m. sharp. Thank you all for your work. Please continue to use help tickets, email, Slack channel, and MS Teams to ask questions, but we will have another office hours a month from now. So in the meantime, thank you all. Have a good day.
Thanks, Jason.
Take care all.